I'm Simon. I'm 39 years old. I suffer from a rare disease known as mucopolysaccharidosis 2, or also known as Hunter syndrome.
Hunter syndrome is also called mucopolysaccharidosis type 2, and it's a rare genetic disorder that is part of a group of disorders that are called lysosomal storage disorders. And basically, the disorder is related to an inability for the body to metabolize complex molecules called mucopolysaccharides.
When Simon was about 14 months, I had noticed a few things. Obviously, we had a hearing problem. Also, his gait when he was walking.
The challenge with diagnosis is the early symptoms of Hunter syndrome are actually very common symptoms which can occur in pediatrics. What's important is that the doctor must be thinking about the potential of the disorder in order to specifically ask for that specific genetic and biochemical testing that is available throughout Canada. What's key is being able to diagnose children very early in the course of disease and then initiate therapy early.
I was diagnosed in about 1979, about a year and a half, and at the time, there was only about 4 people with MPS.
And the most significant impact really relates to progressive bone and joint disease, which leads to joint pain, problems with mobility. The storage in the heart and lungs leads to progressive breathing problems.
Being able to participate in even hockey, baseball, soccer, you name it, just grew up playing and it was fun. It was great for friendships and bonding, and sports has just been another integral kind of a friend that's always been along the way. In 2003, I started on a clinical trial that saved my life. And so it stopped the progression of my disease and doesn't change all the other complications that came along with it.
My advice to other parents is to treat him as if he has no disease. Then only then will you know the limitations, and there are none.
It's a full body disease. I'm in pain 24/7, but it hasn't stood in my way.
It's just been a fascinating roller coaster ride from the late 1970s, early 1980s. But the rapid pace that knowledge has now led to therapies that alter the natural history of disease and improve the quality of life of individuals with Hunter syndrome is truly amazing.
There needs to be more education in regular medical textbooks and medical schools for all MPS diseases.
In 2010, Simon founded the IBell Foundation as a way to spread his message of perseverance to Canadian families and patients suffering from rare diseases.
The IBell Foundation supports the efforts to raise awareness for rare diseases and advocate for rare diseases, primarily in Canada, and to raise funds to support MPS 2 research with the goal of hopefully supporting a cure for MPS 2 in the near future.
There's definitely room and expectation that there's going to be more effective therapies and easier to administer therapies.
Just really believe it yourself, because everyone has something that they have to deal with, invisible or visible. Mine just happens to be really visible, and to use my voice to hopefully help others, that's the reason I do it.
Simon's story helps others because it has given them hope. Hope that have been denied them. When they go into any doctor and told, you've got a death sentence, they look at Simon and they say, this is not so. And it gives the parents a great sense of hope.
Even though the world likes to put you into a corner, into a box, and say this is your condition, is you're defined by those barriers, I continue to break down those barriers every single day.
For more information about MPS 2 and other rare and debilitating conditions, visit this website. And if you suspect your child has Hunter syndrome, please consult with your physician.